When I was approached first as a reviewer and then as a section editor and ultimately as the journal editor for the Journal of Multidisciplinary Healthcare, it had some inherent appeal to me. My training and practice in academic medicine for nigh on 40 years has been in emergency medicine, which is by definition a collaborative specialty. Demonstrating the benefit of an openness to collaboration and addressing clinical issues from different perspectives, ultimately synthesizing those to the benefit of the patient. We try to make sure that what we're going to publish in the journal is potentially impactful to people across the medical spectrum. In a single specialty journal, there'll be reference made to the input needed from other specialists. But what we're trying to do is go one step beyond that and actually discuss the process for getting that multidisciplinary involvement. If you look at where pharmaceutical development, technology advances, opportunities for collaboration are most present right now, I would say probably it's in cardiovascular medicine, which goes beyond just pure cardiology, and in oncology. What I can probably most easily cite is the growth in the last 4 or 5 years of targeted therapies for a couple of cardiac diseases, structural cardiac diseases that we've known about forever. I mean, we all learned about them in medical school. One is cardiac amyloidosis. The other is abbreviated HCM, hypertrophic cardiomyopathy. By looking at that experience over maybe a year or two within a hospital that's busy and sees a lot of these patients, careful writers and researchers can evaluate those real-time interactions and maybe put some guidance around them. Yeah, I think it is of increasing interest to our readership, which are clinicians around the world. The growing and largely unpredictable impact of technology on healthcare. And yes, AI is a key feature of that. For me as a journal editor, my biggest concern would be, can we publish it fast enough before what we're talking about changes to the next generation? I think another thing that would be of interest is the management of common chronic diseases. So the first one that pops into my head is the most readily modifiable cardiovascular risk factor, and that's hypertension. A compelling discussion. Secondly, a topic that prima facie lends itself to a multidisciplinary discussion. We want to see good science. And then finally, we need to see I don't want to use the word compelling again, but a convincing summary, discussion, plan of action. We're very supportive of authors in terms of giving them guidance on what needs to be modified, what could be improved in a manuscript, and perhaps that's more useful to an early career writer. But just because you've been practicing medicine for 20 years, you may not have ever written an article before. So you may need the same advice, even though you're not early career anymore. So we try to be very ecumenical in that sort of guidance. If I'm going to give you advice on submitting something to our journal, first of all, it's got to be very clear that it fits the mission of the journal, which is to discuss multidisciplinary care. Secondly, it needs to pose a question. that number one is logical and compelling, and secondly that it's answerable. The focus of this journal is what are we doing now and how can we do it better.